Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, by the hour, we're getting reports of how country is running out of hospital beds, running out of oxygen, how there's simply no way the medical infrastructure can take any further load. And more people now advised to take care and home care their COVID. So how should you be tackling COVID at home? What is the best way for that home care for COVID? This is what we'll explain to you in this explainer. First up, who can be isolated at home? That's very important to remember. Well, two kinds of people. A, if you're asymptomatic, basically meaning you have very mild illness and your fever and your cough, etc. Symptoms basically are as follows. You have a sore throat, you have muscle pain, you can get nausea, diarrhea, loss of taste and smell, and more with the new variants around now, shortness of breath. In fact, if you don't have shortness of breath, that is when you are called a mild patient, and that's when you can actually home isolate. The other kind of people who can isolate at home and care for COVID at home are patients with moderate illnesses. For example, if you have evidence of lower respiratory disease during your imaging, this basically CT scan, etc., and your saturation level of oxygen is above 94%. So do remember, if you have shortness of breath, if your CT scan is showing increased patching in your lungs, that is the time you need to go to the hospital. Apart from that, you can treat it at home if you do it wisely. Now, for treating COVID at home, there is some equipment that you must always have. Two essentials over there, a thermometer and a pulse oximeter. Pulse oximeter is, all of us are aware of it right now. You can order it online or just get it from a nearest chemist. Both these should be reported, maintain a chart and take it at least twice every day. But what are some of the essentials over here? What are the things that you must do if you're treating COVID at home? First up, drink lots of fluids. Constantly wash your hands with soap and water. Triple layer mask and discard that every 8 hours after disinfection. Disinfect your frequently touched surfaces as well and avoid any daytime naps, etc., as it can lead to some sleeplessness at night. And keep your doctor's number at hand. Keep updating that chart I told you about. Keep sending it to them twice a day. Also, something that has turned out to be a huge help in COVID recovery is drinking lots of water, but also doing steam inhalation and warm water gargles as well. Now that you understand what are the things that you must do apart with the medication that your doctor gives you, some of the red flags, what are the things that you need to keep in mind, and when the following symptoms come, you must report your doctor, and perhaps that's the time you need hospitalization. First up, dip in oxygen level. If your oximeter says it's below 92% or so. If you have slurred speech, if you have weakness in your limbs, something that has gone up exponentially compared to the past few days, if you have difficulty in breathing, if you have pain or pressure in your chest, and if you see discoloration in your lips, face, sometimes in your nails and your fingers as well. Every time that happens, let your doctor know, let him decide what is to be done. And when, this is a most commonly asked question to us, self-isolation but living with other people. How do you do that? Well, for that, the best thing to do is have separate rooms, but also have separate bathrooms. And in the room that you are living in, there should be enough ventilation. Do not share vessels, even linen, and keep all these items segregated for the COVID positive patient. Do not let that mix up with other people in the house. And allot one person in the family who's going to be the caregiver, who will always have a double mask on or an N95, and that person, whenever catering to them, giving them food, etc., should maintain at least 1 meter of distance. So this is what are some of the tips that you can keep in mind if you're treating COVID at home. All right, but apart from that, there are lots of things that you can do. We talked about double masking. We'll dip into that as well towards the end of the program. We'll give you a good demo on how to double mask and what mask to use even if you're treating COVID patients at home. But when I flagged off this issue, lots of questions came up online, and our guests now will be taking some of those questions. We have Dr. Rajiv joining us. He's a Vice Chairman, Research Cell, IMA Kerala. Kerala, a state which has managed to really turn around the COVID story, managed to isolate, managed to treat people at home. So we'll take some good learnings from him. We've got Dr. Praveen. He is the chairman and the interventional cardiology and structural heart diseases at Medanta Medicity in Gurugram. And we've got Dr. Nimrit Shah. He's joining us from the Reliance Hospital in Mumbai. Let me take up the first viewer question, really. This was sent to us by Waqar Mehndi. If we can have that question on air, please. He asks, how do you ascertain the severity of COVID-19 for it to be able to be treated at home? I think this is a very important basic question. More and more doctors right now are saying not everybody needs to be in the hospital, but who needs to be at home? How do you qualify that? Dr. Rajiv, if you could answer that for us, please.
Yes, the severity of COVID-19 is a significant topic here. And remember that these patients are being seen and triaged over the phone or by a video call. So we just have to go with basic demography first. Someone who is older will be at greater risk to have severe disease. And if someone is younger, they're less likely to have severe disease. So that will be the biggest differentiating factor between these two. And then people who are triaging this patient will have experience having talked with other patients in the same format. So obviously, if it's a new person who is doing the triage, he or she will be assisted by someone of experience. So by the patient's profile itself, the number of comorbidities the patient has, in other words, how many other kind of illnesses the patient has, how does the patient look? So that is when you eyeball the patient, what does the patient look like? Are they in distress? So those are some of the basic things that one can do. And then there are what's called the vital signs. The vital signs are, as you know, they're the pulse, the oxygen saturation, and the blood pressure, and also the temperature. So these are some of the parameters that the people who are doing the tele monitoring can use to assess the severity. And as over a period of time, they do see the patient's progress and they have a baseline assessment of the patient. And if there's a significant change in baseline, the people who run that helpline, for example, in Cochin, we have a very large helpline. We've got over lakhs of calls over the years, over the past 1 year, serviced over 50,000 patients. So these people have a dedicated team of personnel who are a large group of people, mostly youngsters, and many of them are not even doctors. So they are all people who are there to help out the community, and they are people from the government sector and the public sector, and all of them together do them.
Okay, let's take the next question now. This has come to us from Nitin Gupta. He says, I have been tested positive yesterday. I have isolated myself in my room. What do I need to do? I have mild chest pain while coughing, little pain in my eyes, and there is no fever. Kindly recommend what to do. Dr. Nimit, can you take that, please?
Yeah. So this is not very uncommon. We get a lot of calls regarding that. So what I would advise here is, well, very important is, as you rightly said, in fact, you had already covered even before we start all these questions. But just to recap it, it's very important that you get in touch with the doctor. So you should have a definite like a friend doctor who could guide you, who can review every morning and evening your symptoms. So that is very important. So,
but Dr. Shah, can I intervene over there? I think effectively what he's asking is that we often tend to misread chest pain, right? The minute, and a lot of patients confuse chest pain to anxiety or to, say, breathlessness as well. So if you are somebody who's facing a mild chest pain, could you just explain to our viewers how exactly to measure that and how to understand the severity of the problem and then how to communicate it?
Sure. So again, as I said, it's very important that you contact your doctor because chest pain could be of various types. The history is very important. Is this patient known to have any heart problem? Or lung problem beforehand? And then you have to distinguish, because if this patient, I'm a cardiologist, if this patient does have angina, and we know many COVID patients are coming with heart problem as well, and we are missing that because we are ignoring this as COVID and patient die because of heart problems. So it's very important to see, is this pain different from your heart or this is new? With cough, you're getting chest pain is because of the inflammation within the heart muscle. Sometimes it's a muscular pain as well. So they have to see, very important, is it giving you breathlessness? Is your saturation levels getting low? That is very important. And if you take simple dolo or paracetamol, is the pain going off? So those are very important. If there's muscular pain and it is only coming off cough and your saturation levels are good, patient is not breathless, I wouldn't be very concerned. But with a cough, with chest pain, if he's getting breathless, his saturations are getting low and he's feeling tightness, then he should rush to the hospital.
Okay. All right. That's good to know. Next question. This is from Anam Ahmad. She asks how to maintain oxygen level at home. I think, and Dr. Praveen, if you can answer that really, I think what she's essentially asking is how, if there are any tips, somebody who's already got COVID is likely, you don't know how it will turn out to be in the couple of days. Is there any aids, some tips you can share that people can practice at home to ensure that the lung is functioning properly?
Okay. So I think this is a very good question, and because most of the people are actually very bothered and very concerned that as soon as they get a single spike of fever or they get a single cough, they think that they have to be admitted, they have to be given remdesivir and all those kind of injections, which is not true. You already started with that. And first of all, I want to give a message to everybody that even if it is COVID, do not get panicked, because most of the disease is mild or at the most moderate. And all of this can be treated just by medications, and more than 50-60%
and can be treated at home, can be treated well at home, right? So that's the reason why we're doing this entire program dedicated to home care really.
Yes.
So if you could answer specifically to this question, when she's trying to understand how to maintain a good lung function and how to maintain oxygen levels. People should obviously be avoiding any kind of exercise, I'm sure.
So what I recommend is that as soon as one suspects or one is diagnosed to have COVID at home, they should keep doing deep breathing exercises, take steam, and do normal activity at home. Do not worry too much about it unless until you have those symptoms. And there is no need to panic or arrange oxygen at home also, because many times people are thinking that arranging a cylinder of oxygen is very important. That's not true. Please do not try to do that.
So can I ask you this again? I'm intervening.
Last thing.
I'm just intervening because this oxygen concentrator going really scarce outside is a big issue. If you could specifically tell us at what stage in your COVID care do you need an oxygen concentrator? Because now doctors are saying, don't come to us, we don't have beds, take an oxygen concentrator and be at home. But who needs it?
Yeah. So those patients who are having severe respiratory symptoms with oxygen levels, the pulse oximeter saturations, going below 90% or below 80%, in those cases only oxygen is required. Above 90%, there is no need to take oxygen. So please do not panic or kind of try to take extra oxygen. It is not going to help anybody at all.
Okay. Let me take the next question now, also very pertinent, something that I get asked very frequently from Saurabh. He says, when does one need to go for a CT scan? Dr. Rajiv, if you could answer that, please.
Yes, a CT scan is a test that looks at in this case, we are looking at the lungs here. It can see things that a chest X-ray cannot see. So that is where the question comes from. So if you have a patient who is having a symptom that is suggesting of lung disease or lung involvement, we know that some people with COVID-19, regardless of their age, can get a bit of lung involvement early on. And to correctly separate these people from those without lung involvement, in certain instances, a CT scan is needed. But I can tell you, among all the COVID-19 patients, the number of people who need a CT scan is very, very small.
Can you give us an example, Dr. Rajiv? Say somebody's contracted COVID, they have fever, and they're checking, they're keeping it under check. It's say 5th day or 6th day when fever is getting under control, but only after medication. Would you say that after a week of proper medication, if the fever is still not under check, then people should go for a CT scan?
This depends on the treating team. There is a team of people who's looking after the patient who are already, as I mentioned, familiar with the patient's baseline. And the baseline, as I mentioned, is extremely important because each patient has a different baseline. So when the team or if the team suspects that this patient is having a clinical deterioration that they can detect, which they can't explain by other means. I'll explain what the commonest reason for deterioration is: anxiety. As as the doctors here have already said, the commonest reason for being short of breath is anxiety, because people are afraid of COVID, and anyone would be afraid sitting at home. So the first thing to determine is to calm the patient down, to see if it's a genuine case of shortness of breath. And if it's a genuine case of shortness of breath,
essentially let your doctor decide.
Absolutely.
Don't pre-decide. Don't pre-decide. Let your doctor take that call whether or not you need a CT scan or not. Dr. Shah quickly wanted to intervene. Yeah.
Can I comment on that, Sonal?
Yes, please go ahead, sir.
So HRCT, there are a lot of misconceptions and it's probably misused as well. So I see a lot of patients, especially treated by family physician. First investigation done is HRCT. And they are avoiding doing COVID RT-PCR because they think if the COVID RT-PCR, the government would be notified and they get all the restrictions. So we should curb seriously the use of HRCT. And if fever is not the criteria of doing an HRCT, it's only when you have an intractable cough, your cough is not getting better, and you start having breathlessness. Okay. That is when you have to do an HRCT.
Important point there. Okay.
And other blood markers, like if your CRP is going very high, your D-dimers are going high, then it's where you get, for mild symptoms, slight fever, your blood markers are good, you haven't developed cough, your breathing is fine, you don't need HRCT at all. So
let me just translate that for my viewer who does not understand D-dimer, etc. It is essentially a blood test which is a good sort of tell to your doctor about the amount of inflammation in your body, and that gives them a good idea about whether or not you're on the path of recovery or whether you're deteriorating because of COVID. Please correct me if I'm wrong over there in my analysis.
Absolutely
okay,
right.
so that is what, so a blood test is what you can get done before you rush in for a CT scan. There's no reason that you should all be lining up, outside your radiologist and getting a CT scan. Let's take the next question now. This is from Indu Dubey. She asks, what vitamins should a COVID-infected person consume, when to begin taking them, and for how long? And if I can just add a bit of my own question to this, people in the house who don't have COVID but are staying in the same house with a person infected, isolated, should they start on those vitamins as well, not knowing if at all it's going to spread, especially with the new variants when it is spreading in the entire family at a go? If I can ask Dr. Praveen to answer that, please.
Okay. So this is a very interesting and a very important question, because many people are consuming far too many vitamins than are really required. So what is happening is that many patients who are at home and many people who are at home and who are kind of trying to prevent themselves from getting COVID, they are trying too much of vitamins. It is not really necessary at all. Vitamin C people can take as a general measure for prevention of any viral illness, and also they can take vitamin D because many people are deficient in vitamin D.
India is generally deficient on vitamin D.
Yeah, so it is reasonable to take that. But certainly, I must tell you that there are no studies which have shown that if you consume a big dose of vitamins, you will really prevent having a COVID infection.
Okay, Dr. Shah quickly wanted to come in. I saw him shaking his head. Please go ahead.
No, I completely agree with Dr. Praveen as well, because there's a lot of, and your question, where other members of the family need, there's no evidence. But, everyone would take it. Even if you ask me, if the patient asked me, I said, okay, fine, go ahead. Go and take vitamin C, a smaller dose. Go take zinc and all. But there's no evidence whether that does any good or bad. It doesn't do much harm, but there's no harm in taking it. Probably, at least it might act as a placebo. Placebo means it's like would relieve the anxiety at least.
All right. So we leave it there. Thank you.
As the doctors have said, it is absolutely, there is no evidence that vitamins have anything to do with COVID-19. Let me get that absolutely clear.
Right.
Now, there are certain instances when a patient can be deficient in a vitamin. That has nothing to do with COVID-19. And if such a patient was found to be deficient, definitely yes. Otherwise, all that vitamins do is to make expensive urine.
All right. Thank you, all three of you, for joining us with that very important advice. We understood perhaps that this is the time when everybody is very anxious. So the quick takeaway over here is, do not rush to the hospital just because you've tested positive. Do watch out for symptoms. Don't wait for result, as that is key now, more and more with variants coming in. And do take the advice of your doctor before you rush in for a CT scan or anything else. Follow their advice. Stay calm. We'll perhaps get out of all of this quite stronger. Thank you all for joining us. On the other side of the break, we tell you some good tips on how to mask up and especially double masking, so important right now, how to do it on the other side. Welcome back. Now we tell you the all-important issue of double masking. So essentially, there are three kinds of masks that you really get out in the market. There is an N95. Let's start with this one. When an N95 is essentially something that you don't need anything on top of. This is a good foolproof way of protecting yourself. But remember, while purchasing an N95, do not buy the one which has a valve in it because that can retain moisture. The best way to wear it, put it on, clip it in, and blow. If you see air coming out of any of the sides, that means you're not wearing it right. It needs to block in. This is good to keep you safe and your surroundings at a near one safe as well. But in case you don't have an N95, what is to be done then? Well, pick up a surgical mask like this. Put it on. But remember, surgical mask alone is not enough because you see over here how there are gaps all this time. So what you need to do is pick this up, turn this around, and then wear it again. You will see how this, just twisting it, will grip in properly. But like I said, this is not enough. You'll have to top it up with a cloth mask. Wear this on top and then do the blow test again. Once it fits in, for me the test is if my specs are not fogging, that means my mask is pretty much in place. I hope this helps with the new variants all around which are spreading like wildfire. It's even more important that you double mask at this time. Stay safe, mask up.